Prime Minister Dr. Keith Mitchell pointed to what appears to him to be a buddy system that provides protection for individuals rather than seek accountability and discipline where necessary. This, he says, cannot be condoned. The Prime Minister emphasized the need for accountability and cooperation as key guiding principles for the proper functioning of the Ministry of Health. The notice was served on them as the Prime Minister continues his series of visits to the various ministries. With the ministry now separated into health and hospitality and community services, the Prime Minister stressed the need for both to function collaboratively, noting there will be a period of adjustment as he reminded them that no decision-making should be done in isolation. Referring to the ministry shared between Minister Steele and Minister Delma Thomas, the Prime Minister said there should be no perception that one minister or permanent secretary is more senior than another, maybe with respect to years of service, but that's all, he says. On the subject of accountability, Dr. Mitchell says it is important that public officers understand the system under which they operate. He implored on the permanent secretaries the importance of understanding the rules that guide the operation of the public sector. Conditions at the Mungay Psychiatric Hospital, the rate of staff turnover, relevant training for nurses and other health staff, the ability of the ministry to adapt the dynamic healthcare profile, and the impact of the chronic disease on healthcare system are some of the issues raised by staff members. In his comment, the Health Minister stated that the past year has been a particularly trying one for the Ministry of Health, noting that the impact of the COVID-19 pandemic has left health workers tired, but they are also stronger and more resilient, and commended all for their efforts. The Prime Minister gave the assurance to fully support the Health Minister and his administrative team. Christina John, GBN News.